pharyngeal airway. It's good for patients with a GCS score of less than 8 or a verbal response less than 2. Now we measure from the incisors to the mandible. That looks about right. Now we're going to tilt this tube and do a head lift. We're going to insert the OPA starting at the palate of the mouth, 180 degrees twisting so we can avoid the tilt. That's perfect. Contraindications are if the patient has a high gag reflex, and complications include induced vomiting if the OPA is too large, obstruct airway if the OPS is too small, and damage to the oropharynx. Demonstrating the insertion of a nasopharyngeal airway. It's good for patients with trismus and can be used in patients with a higher GCS as they don't cause gag reflex. Now we measure from the end of the nostril to the mandible, and that looks about right. Before we insert that, we're just going to lubricate the NPA. Now we're going to insert 90 degree and rotate. If any resistance is met along the way, we can rotate 180 degrees or insert into the other nostril. Contraindications of this is possible base skull fracture, and complications include nasal polyps and bleeding. To an unconscious patient, I'm going to check my hazards. There's nothing here. My gloves are on, so I'm just going to check for response. Hello, sir. Can you hear me? Hello. There's been no response to touch and pain, so I'm going to listen for breathing for 10 seconds. And while I'm doing that, I'm going to just tilt his jaw and his chin. 10 seconds, there is no breathing. Can I please get you to start on compressions while I call for backup? Walk with one, calling comms.
Walk with one, go ahead.
Can we please have a R50 for a R49?
Copy, dispatching now.
Thank you. Alright, I'm just going to apply Deepika pads. Just going to work around you, so I'll keep the compressions going. Right, turning the defib on now.
Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient. Stand clear of patient. Shock advised. Stand clear of patient. Press the orange shock button now.
Alright, all clear. Shocking now.
Shock delivered. Begin CPR.
Alright, back onto the CPR.
It is safe to touch the patient.
Just going to put the OPA
Pause.
and measure
Place
from
overlapping
the
hands
incisors to the
in
mandible.
middle of chest. Pause.
That's
Pause.
fine. I'm just going to insert this. Alright, going to get the oxygen ready. So, did anybody see what happened here? Does anyone know the patient?
No.
Alright. So turning the oxygen up between 10 and 15, I'm going to go on to 10. One secret here, nice and firm. Can you please let me know when you're up to 30 compressions? We'll do 2 breaths. Alright, 2 breaths. Was there a chest rise and fall? Yep. Thank you. Alright, so I can see that the airway is clear. If it wasn't, we'd just use the suction that's there, but it's all good at the moment. Ready? I don't know, 30 please, good compressions, please keep going. Ready?
Assessing heart rhythm. Do not touch the patient.
Alright, we're just going to wait for that. And
Analyzing.
just
Do
going to
not
swap.
touch the patient.
So if you can do 2 breaths while I do 30 compressions. Okay.
Stand clear of patient. Shock advised.
Can you press the orange
Stand
button?
clear of patient. Press the orange shock button now.
All clear?
Shock delivered. Begin CPR.
Alright, on 30, 2 breaths.
Paused.
30, 2 breaths. Nice chest rise and fall, so I'm going to carry on another 30. (29, 30), chest rise and fall. We're demonstrating the use of a suction. Firstly, the patient needs to be in the recovery or lateral position. Now we're going to test the suction, turning it up to 350, making sure that it sucks, and that's fine. Now we're going to insert this into the patient's mouth, only as far as the eye can see, and using circular motions we're going to draw out of the mouth for up to 10 seconds at a time. Complications include induced vomiting, induction to bradycardia, hypoxia, aspiration, soft tissue injury, and laryngospasm. Be demonstrating a collar application. Now to assess this, I'll be using the nexus rule, which is looking at the mechanism of injury. A collar is indicated if there is posterior midline C-spine tenderness, if the patient is intoxicated, if there is decreased level of consciousness, or any other painful distracting injury. Now we're going to measure from the top of the shoulder to the jawline, and then measure that onto the collar, which is about right. Now while we're going to hold the patient's head in a sniffing position, and Leila's going to hold it firm so we don't move the patient around. We're just going to slide this collar through, and we're going to secure it nice and firm. Right. Now complications of this include increased intracranial pressure by decreasing venous return to the head. I'm going to go through a defib orientation. I'm going to turn this on first. Press advisory, and we're going to go into a manual mode so we can do a user test. Okay, that's done. And now we're going to go into options and go into user test. Select user test in progress, so we're just going to wait for that for a bit. Okay, so says user test passed. Alright, now we're going to test the defib, and before that we're going to make sure that the tester is plugged in, which it is. We're going to go into energy select and change that to 150, which is the standard adult dose. We're going to charge this. It's telling me to push the shot button, which I will now. Right, now we're going to disarm the charge, and for that we're going to go back into energy select, just making sure that's still at 150, charge, and we're going to press that button there. Okay, now we're going to change the leads, so we're going to the lead button, and there's all the options. There's 1, 2, 3 and AVF. I'm going to select one of those, and there they are. Okay, now I'm going to change the lead size. For that, you can just go into size. It gives you all the different options there. I'll go into 4.0, which is the biggest. There it is. To adjust the volume, go into the heartbeat, which is connected to Leela here. Select that, volume, and turn it up. We're just going to go out of that, and to show you the CO2 input, it's right here on the corner. Creating a bag, mask and reservoir. Now to check for leaks, we're just going to connect this to the bag mask. Just fill it in. It's fine, there is no leaks. Now we're going to just connect this back to the bag mask. Attach this on as well. Fine. And we're going to connect the mask to the oxygen cylinder. Okay, we're going to turn this on to 10, it's between 10 to 15 litres. Lay that down. And we're going to do a head thrust and chin lift. Nice snug fit on there. So what we're aiming for here is a C grip. phase chest rise and fall. I can deliver a breath every 6 to 8 seconds. This is good for patients in cardiac arrest as it delivers 98% oxygen. Now you can apply pyrocort pressure as it reduces gastroinflation. Oxygen delivery, we check for the oxygen bottle by checking the label on there that says oxygen, and also it has 3 prolong holes. Now we check the Botox seal on there, it's got a seal on it, and we're going to attach this now to the oxygen. Tighten that. Nice and tight. Now we're going to turn it on to check for the content level. Okay, it's on green, which means it's full. Now we're going to attach tubing to this. Now this is an acute mask and it delivers 60% oxygen. We're going to turn it up 4 to 6 liters per minute. And just put this onto the patient. Just lie this down. Making sure it's a snug fit, covering the mouth and the nose. And the patient can adjust this accordingly to make sure that it's a snug fit. You can do that. Okay, when finished, we take this off. And we're going to turn this off. Going to remove the mask from there and then flush this out. I'm going to demonstrate fracture management. This patient here has a suspected mid-shaft tib or fib fracture. I've already offered pain relief, so the injury here is exposed, and I'm going to check for limb, which is warm. It feels similar in both the feet. Color looks fine on both of them. Movement, can you please wiggle your toes for me? Now I'm going to touch your feet. Can you tell me what I'm touching?
Big toe.
Okay, I'm going to check for distal pulse and also capillary refill. Okay, that's fine. Now I'm going to get my partner to immobilize the limb while I slide this splint underneath. Okay, and we're just going to rest the feet. Good. Now while he lifts this up, I'm going to slightly triangle bandages underneath and secure them. Now this is going to go proximal and distal to the injury. Okay, once that's done, I'm going to reassess the limb, which is checking for warmth. Feels fine in both. Color looks similar in both of them. Can you please wiggle your toes for me? I'm going to touch your foot. Can you tell me what I'm touching?
Big toe.
Okay. Distal pulse once again, and cap refill. That's done. Okay, I'd be demonstrating vitals now. First one being the blood pressure. If there was any restricted clothing, I'd be removing that. Placing the cuff over the brachial artery for a nice snug fit, not too tight, not too loose. Next up, I'll be locating a brachial pulse. And once I find that, I'll be inflating the cuff till the pulse disappears. Okay, just with the stethoscope, I'll place that right over where I found the beat. And releasing the cuff. When the heartbeat starts, that's the patient's systolic volume, and when it stops again, that's the diastolic volume. Patient's blood pressure 120/80. A normal systolic value for an adult is between 100 and 140. A normal diastolic is between 60 and 90. Now, I'll be doing a pulse for the patient, which is measuring the heartbeat per minute. Different types of pulses we can do is carotid, brachial, pedal, and radial. I'll be doing a radial pulse because that is ideal for a conscious patient. I'm measuring the pulse for 15 seconds, multiplying that by 4, which will give us a pulse for a minute. While I'm checking for pulse, I'm looking for rate, regularity, and strength. Quite regular, quite strong as well. Okay, so that was 20 beats in the 15 seconds, multiplying that by 4, which is 80 beats per minute. Normal for an adult is 60 to 100 beats per minute. Next up, I'll be doing a respiratory check, which is just measuring the patient's breaths. The way I measure that is by looking at chest rise and fall. We'd usually be doing this while doing the pulse, because when the patient is aware that we're monitoring him, they can alter their breathing. So for 15 seconds, chest rise and fall. Okay, so that was 5 breaths in 15 seconds. Multiply that by 4, that's 20 breaths. Normal for an adult is 12 to 20 breaths per minute. Now I'd be assaulting the patient's chest just to listen for any abnormal noises such as wheezing, wet sounds, crackling or stridor. And I'd be listening to all the 4 corners. If I can just get you to breathe. Okay, if I can just get you to lift up your shirt. And the other side. Okay, so there were not abnormal noises. Quiet is normal, but absence is not.